Test taking is an anxiety-producing situation for both the test taker and the test designer, according to Harrington and Terry in your textbook. This lesson will assist you with obtaining knowledge that can assist you with the NCLEX test taking skills. It is our goal to assist you with the success of this course. Testing purpose is to verify that the nurse will provide safe health care based upon current evidence-based practice. The main purpose is to guarantee the public will have a safe practicing nurse. Even though the NCLEX will be testing with safety in mind, it only tests the minimal competency level. The current design of the NCLEX is known as computerized adaptive testing. This was implemented in 1994. Questions are provided at a basic level, and when the student answers correctly, the level of the question will increase in difficulty until the student answers incorrectly. Then the question will become easier again. The questions will continue until the student has answered enough questions that the computer determines there is enough data to either pass or fail the student. Test candidates for capabilities for safe and effective nursing practice and essential nursing knowledge. NCLEX exam changes are based upon job analysis studies, which are done every 3 years, and the NCLEX exam is reformatted to match the outcomes of those studies. Explanation of the NCLEX test plan is provided by this link. The NCLEX 4 main categories of client needs are safe, effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. Harrington and Terry of your textbook stated it is best when they said, preparation for class and exams is an important function for the students and the professors in the program. Nursing school is very competitive, and you have been accepted because the faculty believe in your ability to succeed. However, it is up to you to do the work involved in clearing the pathway to successful achievement in your nursing courses. To achieve success, you need to know effective ways of preparing before, during, and after a nursing examination. Some success strategies include: organize your knowledge. Review content learned during the years of your nursing curriculum. Identify weaknesses in content knowledge so that you can focus your study time appropriately. Develop test-taking skills so you can demonstrate the knowledge you have. Reduce your level of anxiety by increasing your predictability. And know what to expect. Remember, knowledge is power. You are powerful when you are well prepared and know what to expect. Educators have utilized different techniques to assist students with preparation of the NCLEX RN exam. The most common used theory in Bloom's taxonomy of educational objectives. Bloom used a structure of simpler questions that are knowledge-based, moving towards complex questions involving evaluation and information. The NCLEX RN designs nursing questions based upon Bloom's structure. As you note this table, the NCLEX RN will test levels of knowledge, comprehension, application, and analysis. Knowledge questions emphasize on recalling remembered information. This information can be related to definitions, steps in a procedure, common terms or facts, and identifying a medication, a normal dose, or its side effects. Comprehension questions is the emphasis on understanding the meaning and intent of remembered information. This can include understanding a definition or term, telling why a lab result is important, recognizing what and why a step in a procedure is important, and identifying why or how a medication will work. Application questions emphasis is on remembering understood information and utilizing the information in new situations. This can include applying a definition or term to a new situation, assess the importance of a lab result in relationship to a disease, prioritize what steps in a procedure are important or when they occur, and to evaluate a response to a medication. Analysis questions emphasis is on comparing and contrasting a variety of elements of information. This can include choosing the best definition or term to a new situation, anticipating lab test results with a client's history and/or diagnosis, prioritizing the first step of action to perform when a given set of symptoms occur, and identifying the best medication to give a client according to his or her symptoms and variable given in the STEM. You may be given nursing diagnosis in the STEM and asked to select an appropriate nursing intervention based on the stated nursing diagnosis. You may be asked to select from 4 choices and an appropriate nursing diagnosis for the prescribed case. You may also be asked to choose from 4 nursing diagnoses the one that should have priority based upon the data in the STEM of the question. Prioritizing nursing care. Identify the most important client needs. Which nursing intervention is most important? Which nursing action should be done first? And which response is best? Remember your Maslow, but also take into consideration the complete picture and what should be priority at that time. The NCLEX to RN exam consists of 75 to 265 questions and is random. When presented with a test item, if answered correctly, the candidate is presented a slightly more difficult item until the candidate misses an item. A slightly less difficult item will then follow. This will continue until the candidate achieves a definite pass or a definite fail score. The least amount is 75, with 15 being pilot items that do not count towards the score. Most 265 is the longest time of 6 hours to take, including tutorial and any breaks. The type of NCLEX questions are multiple choice questions, fill in the blank questions, drag and drop questions, multiple response questions, audio items, graphic options, and mathematical calculations. Here presented is a copy of the handout of a decision tree that provides you with the assistance in identifying the stem of the question and the appropriate steps to take and able to answer a question correctly. Some success strategies are: know your strengths and weaknesses, make a list, labeling one column "Know Well" and another column for needs review. Be sure to schedule some time for studying. Set achievable goals. Find a space to study that is conducive to learning. Maintain concentration. Be sure to take care of yourself. And last but not least, utilize practice questions. Okay, now let's review a practice test question. The client is taking a medication that inhibits aldosterone secretion and release. The nurse assesses for what potential complication? A. Dehydration, B. Hyperkalemia, C. Hyponatremia, or D. Fluid volume excess. Okay, using your decision tree handout. Recognize the information in the stem of the question. What is the subject of the question? Recognize keywords in the stem. Recognize who the client is in the stem. Recognize what the topic is about, and determine relevant information. Can't identify the subject or topic? Read the answer options for hints to the subject or topic. Okay, topic or subject identified, then you go to the second stage. Okay, next stage. Ask what is the question asking the nurse to do. Are the keywords in the stem that indicate what to do? Or is the question asking for an assessment or intervention? Or is it assessment before intervening? A combination of assessments and interventions. You read the stem to determine whether you should assess or intervene, then choose the correct answer. Answers all assessments or all interventions, then go to the third stage. Critically analyze the options in relation to the question asked in the stem. So, scrutinize each option in relation to the information in the stem, identify a rationale for each option, compare and contrast the options in relation to the information in the stem and their relationships to one another, and does Maslow's work in the question? No? Are all answers physical? If yes, apply the ABCs. If answers are psychosocial, then go to step 4. If it is yes, eliminate psychosocial answers. Do the physical needs make sense? Apply your ABCs. Eliminate as many options as possible. Eliminate one option at a time. Select the goal or outcome of each of the remaining answers. Is it a desired outcome or goal? Then select a correct answer. Here are some tips for the NCLEX to remember. NCLEX questions do not have a perfectly clear topic. Physical needs take priority over psychosocial needs. Don't automatically select respiratory answers. Follow nursing process. And just because it is an option on the NCLEX, do not assume it is a viable option for the client in question. Ask yourself if the option makes sense for this particular client in this particular situation. This concludes the lesson of NCLEX RN preparation. If you have any questions related to the content of this lesson, please contact the instructor.